Hello and welcome to It's Personal, brought to you by Gundersen Health System. Coming up, in the past, lung cancer was considered a life sentence, but that's changed. You'll learn how you can make a difference in the fight against lung cancer. Also, it's flu shot season. What do you need to know, and what can we expect? We'll find out. And later, an update on Ask Janey. Gundersen Health Plan Senior Preferred earned some well-deserved recognition. That's all next on It's Personal, brought to you by Gundersen Health System.
So basically my knee will be fused with metal?
Well, kind of.
And that means my new knee will be virtually indestructible.
No.
This is Tanner, a local school track star. Following his severe knee injury, he naturally had a few questions for his orthopedic surgeon at Gundersen Health System.
So when you do a full knee, how much of it is robotic?
Well,
I should be able to jump higher, right?
No.
Luckily, Gundersen doctors take extra care in explaining every detail, face to face, for a more personal experience.
What will you give me to make me sleep? How long will I be out? Is my surgery recorded?
Well, we do this.
Is it in HD?
Well, actually...
Cool.
It's just one of the ways we let our patients know they're in the most capable and caring hands. It's a combination of love plus medicine.
And if it's metal, I won't feel a thing. Oh, can I be a cage fighter?
Let's back up just a bit.
Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org. Gundersen, where caring meets excellence.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. There's a big event coming up on November 3rd. It's called Shine a Light, and it's designed to shine a light on lung cancer. Joining us to talk more about the event and lung cancer in general is Curt Edel, Dr. Curt Edel from Gundersen Health System. Thanks for joining us.
Hey, thanks, Chris, for having me.
Lung cancer is not something that people want to hear about as a diagnosis, but we're tackling it better these days.
We are. You know, in lung cancer, traditionally, unfortunately, has been a diagnosis that has been made at late stages. So we all know that the later the stage of cancer is diagnosed, the more poorly it's controlled or treated. But that is changing, and I'm glad you brought that up, because recently, and I say recently over the last couple of years, we've seen lots of evidence looking at diagnosing cancer earlier. So we're starting to see more patients who have a earlier lung cancer diagnosis than we have in the past, which is really encouraging because we have many more treatment options for those patients.
Why the earlier diagnosis? Why was it later previously? What are we doing better now?
Screening. For many years, we never had a screening tool. So we had a colonoscopy for colon cancer, we have a mammogram for breast cancer, but we really didn't have anything for lung cancer. And recent evidence has shown us that screening with a CT scan can really pick up disease earlier in the stage of that disease. So we can now see patients who have stage 1 or early stage cancers who have many more treatment options than when they would have presented with a much later stage disease.
How are we screening now? Is this because providers are asking a set of questions in an exam?
Exactly, yes. So there's a very specific parameter in terms of who should be screened, when they should be screened, ages, and it's worthy of talking with your primary healthcare provider. They can look at these guideline recommendations just like we look at guideline recommendations for who gets screened for a colonoscopy or a mammogram.
Let's talk a little bit more about that if we can, because I think one of those questions is obviously going to be, are you a smoker or smoking in your family, that kind of thing. But what other things might pop up that would be a concern? What other health hazards are out there?
Well, certainly we know that radon is a big risk for patients to develop cancers, particularly lung cancers. We also know that there is a component of family history, but that's not really something that we can really hang our hat on at this day and age. Now, unlike where we can look in, say, in breast cancer, where we can, there's a much more defined risk based on family history.
Maybe it was more environmental is
Right,
what it could
right,
possibly
right.
be versus family. Yeah.
But certainly symptoms, patients who come in with a cough or a pneumonia that just is recalcitrant to, antibiotic treatment or other standard treatments, recurrent upper respiratory tract infections, things like that. I can't tell you how many times we see patients who have had, their pneumonia treated 3 times over again with antibiotics before a cancer diagnosis is made. But symptoms, unintentional weight loss, things like that we look at to say, is there more than just meets the eye? Mm-hmm.
I know one of the issues that pops up from time to time, at least that I've read about, is funding for lung cancer.
Yeah.
Lung cancer doesn't get the same sort of, I'll say, love.
You're exactly right. And it all goes back to, where does the advocacy come from? Because, I hate to compare and contrast cancers or pit one against another, but it is pretty stark when you look at the number of patients diagnosed with lung cancer versus, say, the number of patients diagnosed with breast cancer. Lung cancer patients will outnumber those with breast, and the number of survivors. So even though lung is slightly more than breast in terms of incidence, number of people diagnosed, look at the number of survivors. Lung cancer has maybe 40, 50,000 people who survive each year who are diagnosed of the 220 that are diagnosed, versus breast cancer, where you can have 200,000 that are diagnosed this year, and these are like U.S. statistics, of which 30,000 may succumb to that disease, leaving 170 or 180,000 survivors. Survivors are the advocacy group. Survivors drive advocacy. And unfortunately, lung cancer is a disease that people run from. So even the survivors in lung cancer traditionally don't want to be advocates for that disease, because unfortunately, there's a shame and guilt complex associated with lung cancer. There is a huge stigma. It's like kind of like I did it to myself, where we don't see that stigma, for example, with colon cancer or with breast cancer. So that's really where the advocacy comes from, and I'm really hopeful that we're going to see that change when we start to see more patients, long-term survivors. So more patients who are diagnosed early with that disease. There are people who will come out and say, hey, this is a disease that, yes, it has a smoking association, but that's not the whole story. And I'm a long-term survivor, therefore I could do something about this disease. And I think we're going to see that.
We're talking with Dr. Curt Edel, Gundersen Health System, and we're talking about an event that's coming up, Shine a Light. It's November 3rd from 6 to 8 p.m. If you want more information on that, you can go to the Gundersen Health System website. Dr. Edel, I want to talk a little bit more about that stigma, because I recently, not too long ago, maybe a year ago, talked with a gentleman who had lost his wife to lung cancer. And what he was most upset about was kind of what you're talking about, was everyone assumed that she was a chain smoker.
Absolutely, and we know that that's not the case. Unfortunately, that's where most of the patients who have this disease come from, a smoking history. But that's not all the patients. We know that anywhere from 15% to 20% may not have a smoking history. What's really interesting is most of the patients who are diagnosed had a history of smoking but quit years, sometimes decades ago, who then developed this disease. So it's not just smokers, and it's not just smokers now.
Interesting point. We're talking again with Dr. Curt Edel, and I know you're going to be at the Shine a Light event. Why should people show up?
Education. Really, we are trying to do just that, shine a light bring some evidence, some education to the disease that I think is somewhat stigmatized and poorly understood.
And there's people out there, I'm sure, listening to this program that are saying, I'd like to be a part of something, and this would be something that would be
absolutely
a huge opportunity, because you said there's just not enough advocates for, the fight against lung cancer.
That's absolutely correct.
Yeah. How would you encourage people to get involved in the fight against lung cancer if they can't attend the event November 3rd?
There are avenues here at Gundersen for advocacy. There are advocacy groups. Free to Breathe, Alliance for Lung Cancer. There's many advocacy groups out there that can be found on the web. I'm sure our website will point you in that direction.
And that website, of course, is gundersenhealth.org. Again, we're out of time, but don't forget, Shine a Light. It's happening November 3rd from 6 to 8 p.m. If you'd like more information, again, on the website, gundersenhealth.org. Dr. Edel, thanks for joining us.
Hey, thank you, Chris.
Next on It's Personal, flu shot season is upon us. What do you need to know about the flu vaccine? How has it changed? Find out on It's Personal, brought to you by Gundersen Health System.
Expecting a baby? At Gundersen Health System, we deliver more bundles of joy than any other hospital in western Wisconsin. We calm nervous parents-to-be with care from an experienced staff and personal choices like a nurse, midwife, or water birth. Our newly remodeled labor and delivery offers home-like birthing suites with baby and family staying together in a private room. To learn more about making your pregnancy a joyous experience, visit gundersenhealth.org/pregnancy or call 608-775-8181.
This is Nancy, and this is the first time she's been outside in days. She's been rehabbing at Gundersen Health System, and now she's relaxing comfortably in bed, outside, on the patient terrace.
I'm an outdoor person, and I really missed getting out. I'd sometimes ask the staff to wheel me the long way back to my room after having tests done, just to see something different. Then one day they asked if I'd like to go outside. I thought they were joking.
Having a bed outside the hospital is not usual protocol for the staff at Gundersen, but sometimes a little more personal care is needed.
I'm parked in the sunshine with fresh air, and I think that bird is a goldfinch.
At Gundersen, we believe when a patient is as comfortable as possible, more is possible, and that love really is the best medicine.
Nope, it's a cardinal.
Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org. Gundersen, where caring meets excellence.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Adult immunization rates are down across the country. Here to talk about that is Bridget Pfaff, Infection Control at Gundersen Health System. Thanks for joining us.
Thanks for having me.
Adult rates are down.
Well,
that's a concern.
Definitely. I think there's a big difference between adult immunizations and childhood immunizations. Childhood immunizations, we have laws that require students to be immunized before they can go to school. That keeps those rates up around 90%. For adult immunizations, some of those vaccines hover around 60%, or some of them are newer vaccines like the shingles vaccine, and people haven't really worked that into, yes, I need to get this.
Why do you think that's the case? Because in the past, I would say that the demographic of older folks, they see the need to get that flu shot. You've seen that throughout history, but now that seems to be waning. Do you think there's some poor information out there, or do you think that folks are just deciding maybe this isn't for me?
Well, I think there's all sorts of reasons people skip that flu shot. Number one, they think they're saving it for somebody who needs it worse than them. They may also be just afraid of needles. And other factors come into play. They're just too busy to get into the clinic. They don't realize that there are a lot of easy options. You don't have to have a physician appointment to get that flu shot. So there's all sorts of excuses for not getting the vaccine. But what we don't always remember is that older adults, those over 65, are at highest risk of complications from the flu, whether that's hospitalization or even death that can result.
I think that one of the things I've heard you say in the past is that can you afford to be sick for 10 or 14 days or 20 days. Can you talk a little bit more about that with the flu, the actual flu?
Yeah, the real flu, people who get that say, I was hit by a truck and I crawled into bed and I didn't come out for 7 days. And then what we really see with influenza is it does some damage to the lungs, and people are more prone to secondary infections like pneumonia, and they not only have to crawl in bed when they have the viral illness, but they also then return there because they've gotten something as a secondary infection. So if you get the real flu and then get better, it's definitely something we want you to see your primary care provider, because you could have a pneumonia or something else that's set in following your infection with the flu.
And then in the older population, seniors, a hospitalization is a real threat, and there's cost to that.
Yes, definitely. So the cost of a flu shot is very quickly offset by the cost of being in the hospital. And I think for people like those newer vaccines, like the shingles vaccine, there's a lot of people who all of a sudden they're showing up for the shingles vaccine because one person in their family had shingles, and the pain that can be associated with shingles, it can last for weeks to months. So ensuring that we give people that reminder, this is an important vaccine. Oftentimes with adult health, we're worried about all of the other screenings that are going on. We're doing depression screening when you come in for your annual exam, and all sorts of other evaluation, and don't always remember these simple, easy preventative health that could prevent a lot of pain and anguish, whether that's influenza and being down and out, or it is something as simple as that shingles. And you may never get shingles, but for those people who've had it, they are the first ones to be recommending that vaccine.
And shingles is prevalent, or it is present, I should say, in anyone who has had the chickenpox in the past.
Correct. Anyone who's had chickenpox is at risk of developing shingles, because that virus is sort of like a bear does in the winter, hibernating in their body and waiting for that opportune time to strike and come back out. And it's along the nerve line, so it can be very painful. It can even cause blindness.
Talk a little bit, if you would, and by the way, we're talking with Bridget Pfaff, Infection Control at Gundersen Health System. Talk, if you would, a little bit about the availability of the flu shot, because that's always a concern. People say, hey, when do I go in? And some people come in right away. Is it necessary to come in first day that it's available? And it is available now.
So yes, definitely the flu shot is available. Every year there seems to be something that ebbs and flows with the production of the flu vaccine that causes some people to say, well, I'll just wait. I'll let all the grandparents get it before I go and get it, because it's been short before. We haven't had enough. Oftentimes people refer back to the H1N1 year where we really didn't, it was a scarcity and we had very limited populations that we could immunize. It certainly is something that every year we need to pay attention to, because it relies on a biological system. The vaccine is still made in eggs, and that can sometimes make it go slow. If we have a huge change in the vaccine, because we've had a major change in the flu virus that's circulating, then we see a lot of additional needs for the companies to get additional FDA approval and make sure their new virus is growing well. But this year, that's not the case. We've got plenty of vaccine available.
I'm going to throw you a softball question here, because I want to talk a little bit about population health, because I know there's somebody out there listening to this that is going to say, well, I'm going to let everybody else do it, and I'm not going to take the time or take the risk of going in and having a flu shot. What's your message to them about population health?
Well, nobody likes to think of us as a herd, but we are looking for that herd immunity to get at least 80% of our population immunized to hopefully interrupt the transmission of that flu endemic that happens every year. So there's epidemics, there's pandemics, and there's that endemic level, or that natural level of disease that we expect to circulate through our population. I think you only need to be the person who actually gets the flu once, and that, I guess, would be my message to that person is, none of us are immune if we haven't gotten the vaccine, and the vaccine isn't perfect, and maybe there are some people who've had complications from the vaccine, but the vaccine is the best thing we have to prevent the transmission of the flu and to protect you from the flu. So that's the best option we have right now, and I recommend them getting the vaccine.
And there is a certain percentage of the population that is not able to get a flu shot because of a compromised immune system already.
So there are some people who the vaccine may be contraindicated for. People with a compromised immune system might be more important to get in line to get that vaccine. They need to connect with their primary care provider to see what type of vaccine they get. They shouldn't get the live nasal spray vaccine if they have a compromised immune system. But for the most part, those are individuals we want getting the vaccine. Other folks in thinking of making sure we're not deterring people who think, well, I just don't normally get sick.
Gotcha. There's certainly a large population of people that think, this isn't me, I've never had the flu, I'm tougher than the flu, until they get the flu.
Exactly.
All right. We started this off by talking about the lack of adult immunization. What's your message to those folks out there considering?
Well, I think definitely prioritize with your primary care provider, work with them to be immunized and be evaluating whether it's the pneumonia shot or shingles, tetanus. The new tetanus vaccine has protection against pertussis, which can be a high risk for infants and young children. So grandparents thinking, well, I get that tetanus vaccine for myself, but also not realizing they're protecting their grandchildren by getting immunized as well.
That's a good point. Bridget Pfaff, thanks for joining us. And again, get your flu shot, line up, get it right away if you can. And there is certainly, if you can't get in right away, try and get in at some point soon to get that flu shot.
Yeah, if you haven't had the flu yet, it's not too late to get immunized.
All right.
So we definitely will keep the community abreast of when the flu vaccine is circulating, and we will let you know or when the flu virus is here, right, and go from there.
Good information. Bridget Pfaff, Infection Control, Gundersen Health System. When we come back, we'll ask Janey. Gundersen Health Plan Senior Preferred earned some well-deserved accolades. All next on It's Personal, brought to you by Gundersen Health System.
Nobody likes having blood drawn, especially kids. But Lisa has been a Gundersen Health System lab tech for over 20 years, and she's learned a few tricks to help ease the pain.
When I first started, another tech taught me a secret that's won me a lot of points with my younger patients.
Hey, Bunny!
The hand-drawn bunny bandage, made right in front of the kids so they can see it's just for them. I have some multicolored markers so that the bunnies can even match their outfits.
Little things like this are what make Gundersen different from the rest, providing extra care where it's needed most through all stages of life. We call it love plus medicine.
If I can help them through a scary experience with a simple explanation, a bit of encouragement, and a gentle touch, that's it. I've done my job. Then I top it off with a bunny bandage.
Thanks.
Next time I see them, my face might be a little more welcome.
Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org. Gundersen, where caring meets excellence.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. For those of you who follow this program, you may remember that last month we talked about the Gundersen Health Plan, the Senior Preferred Plan specifically, getting a 5-star rating, and they have done that for 4 years in a row. Well, breaking news, 5 years in a row. Janey Waters, marketing representative for the Gundersen Health Plan, is here to talk about that. Congratulations.
Thank you very much.
It's a big deal, and
It is.
I know you're happy about it. What does it mean for patients?
What it means for patients and members is that their insurance coverage is with a high quality health plan based on surveys that we've received back from them regarding their care, their customer satisfaction, their patient outcomes, access to providers, And it's a big honor because very few companies across the nation receive this 5-star rating.
I hear people talk about healthcare costs, though, all the time. But if you're a senior preferred member, there is some good news there, too, because administrative costs are kind of figured into the senior preferred plan and the survey that ultimately gives you a 5-star rating.
Correct, it is. And we are a very lean health plan. Our overhead, we keep it low because we like to be efficient and we do it well. We've all been there so many years and want to continue to provide that service to our patients and members.
I know for a lot of people, they think of October as the month that they can make any changes to their plan. It's called open enrollment.
Correct.
This is October, but if for some reason it's not working out for you in October because this senior preferred plan has a 5-star rating, you can do that in November or December or January. You can really make those changes.
Or July, yep. Yeah. Yes, being a 5-star plan gives us an open enrollment all year round, which is really handy because when someone gets an insurance notice that their premiums are going up in July, they don't have to wait till the open enrollment if they want to switch to senior preferred. They can get on because of that open enrollment. It also allows our current members, if they're thinking they don't have the plan that best fits their needs anymore, they can call us up and say, I want to switch to this plan, and we can do that for them once, anytime during the year as well.
Let's talk about that switch a little bit. Let's say someone is considering switching. They want to sort of compare, do the compare and contrast. Can they come in and ask Janey?
They sure can. That's what I do. So, and we encourage that. Even if they're not 100% sure, just come in and get the information, and then
people say, I don't want to deal with the paperwork. I've got a ton of paperwork. I don't want to make any changes. It's just going to be too much.
We do it all for you.
Okay.
We do it all for you. So Medicare Made Easy. That's our motto, and that's what we do.
All right. So someone could bring in their information from their current plan, take a look at it, and say, can you show me how this would make a difference with senior preferred?
You got it.
And you do that on a regular basis.
You bet. Every day I do it.
We talk about this, we've talked about this previously, that there is something that we call Ask Janey. So how do I ask Janey? How do I get a hold of you?
You can do it several different ways. You can call our customer service line. I travel to people's homes and around the area visiting with people, so I'm not always at my desk. You can call customer service and they can get you to someone who can set up an appointment. That number is 608-775-8077, or just call me direct, 608-775-8778. I have voicemail.
All right.
And it works.
Sounds great. And making a home visit, all you're probably asking for is some decaffeinated coffee, I'm sure.
Not even.
All right.
But yeah.
Ms. Janey Waters, Marketing Representative for the Gundersen Health Plan. Again, congratulations on your 5-star rating.
Thank you very much.
If you'd like more information about Senior Preferred, you can go to the Gundersen Health System website. That's gundersenhealth.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. If you'd like more information about any of the healthcare topics on today's program, go to the Gundersen Health System website. And while on the website, be sure to sign up for MyCare. You have access to your provider and your health information all right there at your fingertips. You can do that, again, at gundersenhealth.org. And again, that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.
Having recently lost her mother to cancer, Margie Mason wasn't ready for what she was about to hear.
I was faced with stage 4 cancer. Within a half an hour, there were several radiologists in. There was a surgeon consulted, an oncologist consulted.
Together with her care team at Gundersen, she faced her challenge head-on.
One of the neatest things about Gundersen is the No Sleepless Nights program. You go home with an answer. They make sure you have a plan.
Margie became a warrior in her fight against cancer.
When I think of Gundersen, I think of where caring meets excellence. Without that, I wouldn't be sitting here with you today. They knew what to do, how to do it, and how to keep me going. They saved my life.
Gundersen Health System, where caring meets excellence. For more of Margie's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.